Welcome to my world, the world of the medical laboratory scientist. Health is wealth, knowledge is power. Identifying the 7 types of diabetes. Diabetes is a serious problem with serious complications, and one needs to really understand in order to identify the type of diabetes the person is suffering from. Diabetes could be type 1, that is when one experience the autoimmune problem where the isolates, the beta cells of the pancreas are destroyed so early, and so there are no insulin. Such a person depends on insulin, so it's from childhood onset. Then there is the type 2 where the insulin is not enough, and that is usually as we grow older, and it could be as a result of the different problems that hyperglycemia and hypoglycemia, or what we call dysglycemia, are caused. So the person becomes diabetes. And there are 7 different types, which I shall list as we go into the slide session. But the way to really identify them is very important, because treatment is necessary in addressing the cause, and that cause will always help one in the right direction of effective treatment, efficacious treatment. The other remaining types, you will be wondering: type 1, type 2, then we should have type 3, type 4, type 5, type 6, type 7. It is not numbered like that, though we have type 3 of recent, and it's now called type T3C, that is diabetes type 3C. What that involves is more of a pancreatic genetic problems. The gestation diabetes is usually during a pregnancy, and one should be very careful to correct it so that it will not affect the baby. And all these various types, one needs to identify them so that one does not allow it to become a resistant problem where you will now depend solely on insulin injection, or worse, the complications sets in. Like I've always said, if you like my presentation, press the like button, subscribe. More information will come your way as we go into the slide section. The outline: objective introduction, list of the 7 types of diabetes, diagnosis and treatment are all I shall be talking on. The objective: to create more awareness of the different types of diabetes and how the diagnosis aids effective treatment. The introduction: diabetes has been known for many years as a sugar metabolic health issue. It was then categorized into diabetes mellitus and insipidus. Mellitus is a Latin word meaning sweetened or honeyed, referring to the high levels of sugar found in the urine of people with diabetes. And you can understand they even tasted the urine. People still taste the urine these days. Diabetes mellitus means excess urination with sweet taste. With diabetes insipidus does not involve high blood sugar level, but you have excess urine. Later, diabetes mellitus was broken into 2: insulin dependent diabetes mellitus and non-insulin dependent diabetes mellitus. The IDDM was later standardized as type 1 diabetes, encompassing both the juvenile diabetes and adult onset autoimmune diabetes. NIDDM became type 2 diabetes. The important work of the 19th century French physiologist Claude Bernard opened up the knowledge of these diabetes. In 1889, Oskar Minkowski and Joseph von Mering performed the experiment of removing the pancreas from a dog and producing severe and fatal diabetes. That is how they were able to discover
originates from the pancreas ineffective function. In 1921, Frederick Martin and Charles Bess isolated insulin from pancreatic islets and administered to patients suffering from diabetes type 1, saving their lives and inaugurating a new era in diabetes treatment. Many researchers have helped confirm the different types of diabetes that follow. The 7 types of diabetes. These types are distinguished by their causes, how the body processes insulin, and the symptom of conditions that triggers them. Type 1 diabetes, we all know, is as a result of the a chronic autoimmune condition affecting children, babies from onset, requiring lifelong insulin therapy, a healthy diet, and regular exercise. Type 2 diabetes is a progressive condition which I had explained earlier. It has to do with dysglycemia, especially eating habit. It could also be genetic. And the most common type of diabetes is type 2, affecting over 85%. It's often linked to genetic overweight and obesity and a lack of exercise. The gestational diabetes is during pregnancy. Some women in pregnancy, they have this diabetes condition. It can increase the risk of complication for both the mother and baby. The 4th one is maturity onset diabetes of the young, a rare inherited form of diabetes caused by a genetic mutation that affects insulin production of function. It can affect people of any age and is often mistaken for type 1 or type 2. There is the 5th one, neonatal diabetes, a rare form of diabetes that appears within the first 6 months of life. It's like the baby from the womb probably starve. It is often caused by a genetic mutation and requires careful management to ensure proper growth and development. 6 is latent autoimmune diabetes in adult, LADA. It is all autoimmune condition like the type 1. And 7 is the type 3C that is most recent, also known as pancreatogenic diabetes, occurring when the pancreas is damaged due to conditions like chronic pancreatitis, where it's common with chronic alcoholic, that is alcohol intake, or cystic fibrosis, affecting its ability to produce insulin and digestive enzyme. The diagnosis. We were talking of both clinical and laboratory diagnosis, and the clinician has so many things to measure, as well as the symptoms, history, and what have you. And the laboratory blood test should include fasting glucose, the HbA glycosylated hemoglobin, followed by either further evaluation of the oral glucose tolerance test. Where there is impairment, the values you get could even indicate that the person is pre-diabetes, and the lifestyle and what have you should be changed, advised, possibly. While a fasting glucose of 126 or thereabout may already indicate the presence of diabetes, just for more extra care, lifestyle especially, to avoid dysglycemia, but to eating too much or alcohol intake reduce. So there's also the presence of isolate autoantibody tests that could be done. The insulin test may also be done, and it may confirm. We can confirm the T3C diabetes management by doing the PP, postprandial response to mixed nutrient injection. Finally, treatment. That's the main purview of the medical clinician, the doctor. Approximately 589 million adults, that is 20 to 79 years of age, are living with diabetes, and over 4 in 5 are resident in low and medium income countries. So treatment is necessary and advocacy as well for prevention, especially lifestyle modification and what have you. Type 1 diabetes management requires lifelong insulin therapy and careful monitoring of blood sugar. Type 2, you can talk of giving metformin and the oral medications. Lifestyle changes as well. Gestational usually resolve after childbirth, but increases the risk of developing type 2 diabetes later. The type 3C diabetes result from pancreatic damage. So they advise, especially alcohol, people who take too much alcohol could damage their pancreas, just like they damage their livers. So these are what could result into diabetes for people like that. And like I've always said, you can always watch more of my videos, because this should be the 207th video produced by me, and you can get more knowledge on health matters so that we can all live healthy. We all gain from this exposition. Thank you.